Sometimes patients, especially young girls, ask me, "Doctor, I want a very small tip for my nose." And I also remember a very famous person here in Albania who many years ago asked me for the favor of making a tiny nose with a very narrow tip. I told her it can't be done in your case and you risk not being able to breathe anymore. In the end, she decided to have the surgery elsewhere, and still after many years she suffers the consequences. Because at first glance it seems like a simple request. In reality, however, the nose is not an object that can be reduced indefinitely according to the patient's desire. There are biological limits that aren't seen in photos or on social media. Even when the surgery is performed with precise technique, the body continues to react and heal according to its own mechanisms. At this point, one of the most common misunderstandings in rhinoplasty can arise because sometimes the tip of the nose doesn't become as small as the patient had imagined. To understand it, one must understand what actually happens in the tissues after the surgery. Hello everyone, I am Dr. Skerdi Faria, founder of Keit Hospital. Today we will talk about a topic concerning one of the most frequent expectations of rhinoplasty. Why can't every patient have a very small nose tip? Many people consider it a simple aesthetic choice, as if it were enough to ask for it to get it. In practice, however, the limits are determined by individual anatomy and the way the body heals. One of the main reasons I want to highlight is the complication related to fibrous tissue, which can cause a subcutaneous increase and influence the final dimensions of the nose tip even when the surgery was performed with great care. If we analyze the nose as a whole, it is composed of a bony structure in the upper part and a cartilaginous structure in the middle and lower part. On these structures are the skin and the subcutaneous tissue. The bony part determines the upper base, while the cartilaginous part forms the bridge and the tip of the nose. The tip is mainly made up of the lower alar cartilages that define the shape, orientation, and projection. Between the bony and cartilaginous structures and the skin, there are connective layers that hold the tissues in place and influence the healing process. For this reason, every modification of the cartilage, skin, or subcutaneous tissue is directly reflected in the final appearance of the tip. In some patients, the skin of the nose is thicker and heavier, especially when it has a higher sebaceous content. This type of skin doesn't have the same ability to adapt to a reduced skeleton. Even if the cartilages are precisely refined, the skin may not retract in proportion to the reduction of the underlying structure. This causes the contour to not appear as defined as expected. In these cases, the limit isn't just surgical, but is also determined by how the skin adapts to the new shape of the nose. Furthermore, between the cartilage and the skin, there's a subcutaneous layer containing fibrous and adipose components. In some individuals, this layer is naturally more developed. When it's thicker or when it has thickened after previous surgeries, it can maintain a volume that makes the tip fuller. Even if the skeleton has been carefully corrected, the presence of this intermediate layer can soften the tip's profile and limit its definition. Let's move on to the initial phase, the hours and days following the surgery. During this period, the most obvious element is the swelling. This is a normal reaction. The operated area receives a greater blood flow and the nose as a whole appears more voluminous, sometimes even not perfectly uniform. This appearance can worry the patient, but generally it doesn't represent the final result. In this phase, the tip often appears larger because fluid drainage through the lymphatic system is slower and the subcutaneous tissue reacts more intensely. Subsequently, the repair phase begins. The body begins to close the internal spaces and stabilize the treated area. It's precisely in this phase that the formation of fibrous tissue begins. It's a biological process. The body produces connective tissue to strengthen the area where the intervention took place. In normal amounts, this is part of the healing process. The problem arises when production is greater than necessary. In the first few weeks, fibrous tissue may not be visible to the naked eye. What is felt most is the sensation. The area becomes harder to the touch. The patient might say the tip is stiff or it doesn't feel soft. This consistency doesn't necessarily indicate a permanent problem, but it's the first sign that healing is entering the connective tissue organization phase. When fibrous tissue increases significantly, an internal layer is created that takes up space. Even if the cartilaginous structure has been precisely reduced, the increase in fibrous tissue under the skin can make the tip appear larger. It doesn't mean that the cartilage wasn't worked on correctly. It means that a new layer has formed over it, which changes the visual perception of the shape. That is why a very small tip is not achievable in all patients. In the first months, this phenomenon is often variable. Some days it appears more evident, others less so. However, when the connective tissue becomes denser, the tip tends to stabilize. It is at this moment that frustration can emerge. The patient perceives that time has passed, the swelling has partially reduced, but the tip does not yet have the imagined dimensions. We now enter a very important phase from the second month until about the sixth. In this phase, the fibrous tissue can cause internal stiffening, limit tissue mobility, and reduce the definition of the tip's contour. If the expectation was to obtain a very small tip, it is right here that the biological limit becomes evident. In some cases, in the area immediately above the tip, an evident feeling can form due to the accumulation of fibrous tissue. If the skin does not adapt completely to the new skeleton, or if a denser fibrous tissue develops in that area, the area above the tip may appear fuller. This creates a visual discrepancy between the bridge and the tip, and is a clear example of the fact that an aggressive reduction does not always guarantee a smaller tip. Another important aspect is that the swelling or the fibrous tissue is not always distributed uniformly. This means that the contour may appear slightly irregular, especially on one side. It is not a marked asymmetry but a slight variation of the profile. This happens because healing is a biological process. One side may react more intensely, creating more fibrous tissue, or it takes longer to deflate, or it may have required more manipulation during the surgery. In patients who have already undergone previous surgeries, the risk of this complication is increased. Inside the nose, there may be stiffened and less vascularized tissues. In secondary rhinoplasty, the tissues are no longer intact, they have already gone through a complete healing cycle and have formed organized fibrous tissue. This tissue can adhere to the structures between them, limiting the movement of the cartilages and making their mobilization and the surgeon's work more complex during the second surgery. Furthermore, the blood supply may be reduced compared to the initial situation, making the biological response more intense and less predictable. Every new manipulation on fibrotic ground can stimulate a further cycle of fibrous production. For this reason, in secondary rhinoplasty, the goal of obtaining a very small tip is often more limited and requires an even more careful evaluation. Let's now connect this aspect to the functional part. We must always remember that the nose is a very important organ and that its primary function is breathing. When seeking a significant reduction of the tip, there is a risk of compromising the stability of the nose. If the structure is thinned out excessively while fibrous tissue increases subcutaneous thickness, two opposite effects can occur. Externally, the tip may appear fuller, while internally the support can turn out to be more fragile. This can also affect breathing, especially in the lower part, where the nostril opening must remain stable during inhalation. It is important to understand that overly aggressive procedures to thin the tip are not without their risks. Beneath the skin, there is a delicate network of blood vessels that nourishes it. Excessive removal of subcutaneous tissue can damage this network and increase the risk of difficult healing, surface irregularities, or even necrosis. For this reason, the treatment of the tip requires balance and caution. That is why, during the planning phase, we do not pursue the smallest tip possible at any cost. Instead, we aim for a shape harmonious with the face that maintains stability and respects the limits of healing. When we know a patient has a predisposition to fibrosis, or when the skin and subcutaneous tissue are thicker, it is necessary to be clear. The result can be elegant and improved, but not necessarily tiny, as is often shown on social media. Let's now move on to managing this rare complication like fibrous tissue, still following the chronological order. Initially, the primary approach is time and observation. One must not confuse normal swelling with a permanent change. Subsequently, if a localized, hard and visible area appears, the doctor can evaluate targeted measures to reduce this stiffness. Such decisions must be made with caution because unnecessary interventions can alter the course of healing. Such decisions must be made with caution since unnecessary interventions can alter the course of healing. In selected cases, local cortisone injections can be applied to limit the increase of fibrous tissue in a specific spot. This is not a routine practice and requires careful evaluation, since an improper dosage can cause unwanted skin thinning or depressions. The goal is a gradual attenuation, not a sudden change. If after many months the tissue increase in the tip remains evident and stable, a corrective procedure can be considered. However, this represents the last option and not a quick fix. A second surgery on already fibrotic tissue can indeed trigger the same biological response again, or even an exaggerated one, with more fibrous tissue production. For this reason, haste is the enemy of the result. From the 6th month up to 1 year, late changes can be observed. Often the tip begins to soften and gain more definition and projection as the tissues continue to reorganize. In some patients, this improvement is evident, while in others it remains limited. It depends on individual predisposition and the density of the fibrous tissue that has formed. The final message for the public is clear. Not every patient can get a very small nose tip, because it's not just about sculpting a shape and because the nose isn't made of modeling clay. It's a collaboration between individual anatomy and the healing process, as well as the surgical technique and the surgeon's skill. When this rare complication related to fibrous tissue occurs, the final contour may be less defined, even though the surgery was performed with the utmost precision. This doesn't call into question the effectiveness of rhinoplasty, because as we said before, it's a very rare event, but it means that it's necessary to set realistic expectations. The goal isn't to create the same nose model for everyone, but to achieve a harmonious, stable, and safe improvement, respecting biological limits. If we understand this from the start, we avoid disappointment and make more informed decisions. I'll conclude with a clear concept. A small tip isn't always synonymous with beauty and isn't always achievable. In some patients, this rare complication related to fibrous tissue represents the limit. A good result is one that respects the face, preserves breathing, and adapts to the way the body heals, not one that follows a single standard. Thank you all for your attention. And if you've made it to the end of this video, it means you can also leave a like or share it with people who might be interested. Subscribing to the channel is always a pleasure for us. See you next time.